Welcome back, my people. Let's get back to our topic of discussion, whereby we are discussing about tonsillitis. Guys, continue subscribing, sharing, and liking our videos so that they may reach as many people as possible. Thank you for the support you are showing me, and I hope this support will continue. And I always appreciate your support, guys. So let's get back to our topic of discussion, and in this video we are going to discuss about the risk factors. The risk factors, all predisposing factors, all factors that can put your child at risk of getting tonsillitis. One is what we call young age. This means mostly this disease affects the young age. As we have discussed in the previous video, young age are the ones who are prone to this kind of an infection. The next point is frequent exposure to germs. Frequent exposure to germs. School age children are in close contact with peers and are frequently exposed to bacteria and this kind of a virus that causes tonsillitis. So you will find that when children are in school, for example, this child has a bottle of water and the child is having tonsillitis. So children tend to share their personal items. So when this child is taking his or her water, here a friend is willing to up a sip. So if this child is having tonsillitis and gives the bottle of water to his or her friend to take a sip, that easily transmits or spreads the bacteria or the virus, the tonsillitis virus, from this child to the other one. So that's what we mean by frequent exposure to germs. Next point, let's try to discuss about treatment or how we can manage tonsillitis. Mostly we aim at eradicating the bacteria and the virus. Let's talk about the bacteria. In most cases we use antibiotics to kill the bacteria, and these antibiotics, it will all depend on the level of infection. That's why I can't give a specific dosage, or I can't give the specific antibiotic that can be used, because we have a wide range of antibiotics. But what you have to know, antibiotics are used to kill this kind of a bacteria that causes tonsillitis. On the part of the virus, in most cases the virus doesn't need any treatment, because your immune system or the child's immune system fights back the virus. I hope you get that point. So let's get to our next point of discussion, whereby we are going to discuss the complications that may arise as a result of tonsillitis. One, we have what we call disrupted breathing during sleep or obstructive sleep apnea. This is whereby you find that when a child is having tonsillitis, or when the tonsils are inflamed, they will always obvious any inflammation within the neck region will interfere with the airway or the breathing system, and this makes a child start groaning or having what we call disrupted sleep, especially during sleep. Number two, we have the next point, infection that spreads deep. Infection that spreads deep into surrounding tissue, or tonsillar cellulitis. If these tonsils are infected by this bacteria or virus, it will obvious spread to the other parts around the tonsils and cause what we call tonsillar cellulitis, which is always very painful. Number 3, we have the third complication is what we call infection that results in a collection of pus behind a tonsil, which is also called peritonsillar abscess. So when this infection surrounds the tonsil and makes it infected, it makes this part have accumulation of pus leading to peritonsillar abscess. Number 4, the next complication is what we call rheumatic fever. This is a serious inflammatory condition that can affect. Rheumatic fever is a serious inflammatory condition that can affect joints, nervous system, the heart, and the skin. The other one, we have a complication of scarlet fever. This is whereby we have a type of bacteria called streptococcus. So in this complication, streptococcal infection is always characterized by prominent rash. Number 6, we have the sixth complication is inflammation of the kidney. Inflammation of the kidney. So here we have what we call post-streptococcal. If you listen at that name, streptococcal is a type of bacteria. So we will have inflammation of the kidney, or what we call post-streptococcal glomerulonephritis. This comes from the word glomerulus, which simply refers to the kidney. So glomerulonephritis, forgive me for that. Another point is what we call post-streptococcal reactive arthritis. Post-streptococcal reactive arthritis. This shows that this condition can be sometimes very, very difficult to handle, and if left untreated, it can cause severe complication. So in post-streptococcal reactive arthritis, this condition is a condition causing inflammation of joints. Inflammation of the joints. So let's discuss about the prevention measures, or how we can prevent tonsillitis. So in prevention, germs that cause viral and bacterial tonsillitis are contagious. So the best prevention is to practice hygiene. I hope you get that point. Germs that cause viral and bacterial tonsillitis are contagious. So the best prevention measures is to practice what we call hygiene. For example, hygiene simply means cleanliness. For example, teach your child, when the child is young, teach the child to wash his or her hands after visiting the toilet. Wash his or her hands thoroughly after visiting the toilet or before eating. Number 2, teach the child to avoid sharing food, drinks, glasses, water bottles, or utensils. Teach the child to avoid sharing drinks, glasses, water bottles, or utensils. This simply means the personal items. The last point, replace his or her toothbrush after being diagnosed with tonsillitis. Replace his or her toothbrush after the child has been diagnosed with the tonsillitis, because the toothbrush will carry the bacteria or the virus, and the child, after the child heals, the germs within the toothbrush bristles can cause what we call recurrence or reinfection. This marks the end of our discussion today. I hope, guys, you have enjoyed our discussion. Being on a Sunday, for those who have gone to church, I hope you have been blessed. So let's continue sharing our content. Let's continue liking, commenting, and if you have any point you want us to discuss, just put it in the comment section and we'll be in a position to educate you. Guys, let's keep the support on. Let's continue subscribing, liking, and most importantly, let's maintain peace. Have a good evening.